All right, so welcome to part two. Um, so, picking up where we left off, we're going to talk about functional behavior assessment. You may have heard about this often. The acronym FBA is thrown around. Um, this is this is a process. It's not a document. It's really a way of thinking about behavior. And really, the way of thinking applies to everyone in the world, not just kids with disabilities or exceptionalities. So, the these amendments here, and you can have this on your notes, and you can read that. But the reauthorization in 2004 of IDEA required that an IEP team use functional behavior assessment, conduct one, and that would be the basis for a behavior intervention plan. And we'll talk about what positive behavior interventions and supports are. So FBA before was a practice. We knew it was a good practice. We knew it worked. In 2004, IDEA, which is, remember, is PL 94142, passed in 1975, reauthorized a few times. Now we call it IDEA, IDEIA actually. In 2004, the reauthorization mandated that every kid, if they receive services for behavioral problems, that their behavior intervention plan is driven by a functional behavior assessment. So what is it? Hang on one second. All right, you've got this slide in front of you, but the first thing that I want to explain to you is what a functional behavior assessment is. We have an entire course, 2 courses that teach this process. So what I'm about to tell you is very, very abbreviated. It is the essentials of understanding what this is. But it's basically a systematic way of asking this question. Why is an individual doing what they are doing? Sounds simple, but sometimes when we have kids with really problematic behavior, those behaviors don't seem to make sense to us. They don't lend themselves to really easy explanation. Why would a kid, for example, scream when he is walking down the hallway? Scream. Well, what we know, and functional behavior assessment is based on this logic, everyone does everything that they do because they get something out of it. And that's what the FBA process is. What's the reward? What's the payoff? And if we can figure out what the payoff is, either we can teach the kid a new way to get that payoff, or we can gradually try to find a new payoff for the kid. And for that example, and I've seen it over and over, kids who walk through the hallways and yell, often those are kids with autism. And the reason that they walk through the hallways and yell, and I'm thinking of like one kid in particular, is because it feels good. They like the echo. And that's, sometimes unique to kids with autism. They enjoy it. They get reinforcement. They get reward out of hearing their voice bounce back to them. If we can understand that, rather than assuming, oh, this kid's crazy, or this kid's just really rude and he needs to quit it, we can maybe make him quit yelling, but he's still going to have the need for that sensory input, that stimulation that has to do with what autism is about. So instead, we could, if we through functional behavior assessment, figure out that this kid's getting rewarded by that sensory stimulation. It feels good to hear that scream yelled out, or we would basically teach him to not do it in the hallway, but maybe when they get to class, he can get some sensory input in some kind of way that doesn't involve screaming. A less severe example is you may have a kid who, every time you give him a math worksheet, flips over his desk, tells you to go, jump in a lake and runs out of the room. Why does a kid do that? Well, the quick non-analytical explanation is, well, the kid's just rude. He's a little jerk. He's misbehaved. He's oppositional defiant. He's just like his brother who you had last year. Through functional behavior assessment, we can find insights such as, this kid doesn't know how to do basic calculation. So when you put a 3-digit multiplication problem in front of him, which requires basic addition, he simply can't do it. He's going to flip the desk over to get the reward of being away from the experience of failure. That's the reward, the getting away. Everybody, either we do what we do to get something, or we do what we do to get away from something. In every case, not without exception. So in the case of that kid, if the kid wants to escape the failure experience of mathematics that he can't do, or you can fill in whatever academic experience that you would like to, rather than punishing that kid, rather than putting him on some kind of a behavior modification plan, what we would know from functional behavior assessment is, well, this kid has got academic problems. I can give him a little bit of extra academic teaching, extra mathematics support, maybe fill in some of those gaps that he's missing in knowledge and skill, and guess what? His behavior problem will take care of itself. He won't have the need to flip over his desk and tell you to go somewhere and run out of the classroom, because now the reward will be, hey, he can succeed with the mathematics. So what functional behavior assessment does is it allows us to be very precise with our intervention as opposed to just taking a guess. So with these slides, I'm gonna scoot by these. You have these in your notes, and there's a discussion that corresponds to the reading. I'm gonna scoot by it. I'm just gonna hit the big idea. So let's take a look at this. You got Chris. There he is at the bottom. He's 7 years old. He's diagnosed with an emotional disability. See, he comes with a label. We're already biased, right? He shouts, he swears, and he throws materials when he's asked to complete science lab worksheets. What's up with Chris? What, does he have ADHD? Does he need some Ritalin, maybe something like that? So think about that. Here's another one. You got Arlene, 12 years old. She's got a diagnosis of mild intellectual disability. Arlene is a student with a mild intellectual disability, person first language. High-pitched vocalization. She throws work materials when teachers ask her to work directly with peers within the classroom. What's wrong with Arlene? Huh? Why does she do what she does? Well, she's got an intellectual disability. That's just what they do. We need to make sure that every time she throws work materials that we punish her, that we teach her not to throw work materials. See that? And that's not good advice. I'm being sarcastic there. But that's often what happens. That's the non-analytical, the unspecific approach to behavioral intervention. We're going to get to it in a minute, what it would look like driven by FBA. I'm going to skip that one. So now let's go to Chris. Get a picture of Chris again. 7 years old. He emotional behavior disorder. He shouts, swears, throws stuff when he's asked to complete science lab worksheets. What's he getting out of it? Negative reinforcement. Don't get too caught up with the behavioral language. Negative reinforcement is not punishment. Don't get confused. It's very frequently misunderstood. Negative reinforcement suggests a reward. Negative reinforcement suggests relief, escape. So a kid like Chris in that situation would be avoiding difficult tasks. So what do? Well, if we know that he's doing what he's doing to experience this good feeling of relief from science worksheets, well, maybe we could consider manipulating task difficulty. Maybe it's too hard. Maybe we need to adjust some aspect of it to match his current level of knowledge and skill with this material. That could be it. Escape extinction, that's a little complex. I can tell you what that is in person. Or we could teach, for example, if Chris really he gets emotionally overwhelmed and he thinks, I'm going to freak out, I can't do this, I can't do this, I can't do this, and he wants to run away. I mean, that's really your body's physiological anxiety taking over. Instead, we could just teach Chris, hey, if you feel overwhelmed, you raise your hand, you can say quietly to me, I need to take a break, and then we can establish, we'll go over here for 5 minutes, and then you'll come back and you're going to ask for assistance. That's another way that we can deal with the kid's needs. This kid needs relief from stuff that's hard. Either we can offer that relief by changing the task itself, offering more support, or we can teach him how to get that relief in a way that's socially appropriate, ask for a break, instead of shouting and swearing and running out of the room. that wouldn't be our end goal. I mean, eventually we'd want him to be able to try the work even when it's challenging, but we would take it one step at a time. So go back to Arlene. Arlene, 12 years old. She's got an intellectual disability. She, screams really loud, throws work materials when she's asked to work with other kids in the classroom. As an example, what she could be asking for is positive reinforcement. Positive reinforcement is also a form of reward like negative reinforcement, but positive reinforcement is gratification. It's getting something. And it could be that what Arlene has learned to do is when she wants adults to come to her and give her attention and give her help, she doesn't ask for it. She screams. And if in the past adults have come to her when she screams, well, then she's going to scream more in the future because it gets her what she wants. So instead of screaming, don't pay attention to, don't pay attention to the first one, the DRO there. The first thing we could do is we could teach her a new way of getting what she wants. If she wants attention, show her how to get that attention in a way that doesn't involve screaming. That's teaching a social skill. If we just teach her not to scream, without teaching her some new way of gratifying her needs, her need for attention, she will find a new way. And it might be worse than screaming. So you see, if we punish behavior without teaching new behavior, we're actually moving in the wrong direction. I'll direct your attention to that third bullet there, that when we have a kid who is trying to get something, especially when it involves adults, and they're doing it in a way that's not very socially appropriate, right there, that assessment, that functional behavior assessment, that insight tells us what our teaching needs to involve. We need to teach a new social skill of getting somebody's attention. All right, we're going to skip Felix there. You can look at Felix. It's printed, though. So the logic behind this is that behaviors don't just happen for some random reason. They happen for a reason always. Now, is it always just because somebody is either getting something or getting relief from something? Not necessarily, but about 90% of it is. Behavior is an interaction of, yes, the environment, but also the individual, who they are as a person, how their body works, how their brain works, and then, especially because you all are school teachers, the environment, a big part of the environment is the instruction itself. Behaviors really happen because kids are responding to kids as individuals with unique biology, unique perspectives, unique past experiences, as they respond to their environment, to what they're asked to do within that environment. To a great degree, we as teachers, if we know what it is kids want, we can change the environment within reason to help that kid function better. All right, and you can read that, but I just described that. All right, sorry for that little pause there. So this whole idea of functional behavior assessment, if this interests you, and really this understanding functional behavior assessment and the behavioral science ideas behind it is really good for any teacher. If you're interested, I teach a class in that, which is SPED 606. That's an Introduction to Applied Behavior Analysis, Functional Behavior Assessment, and it's actually an elective in most of your programs. So if you're interested in that, it is kind of a good skill set to have. But so once we have that insight, why is the kid doing what he's doing? What do we do with that? Well, we make a plan. If this kid is getting special education services specifically for a behavioral problem, then we don't just, in some kind of willy-nilly unstructured way, say that, all right, we're going to help him out. It really needs to be laid out. It needs to be planned. And that is what's outlined in the behavior intervention plan. There's a lot to it again, but I'm going to direct your attention. I want you to go seek this out. I'm going to ask you all some direct questions about this when we come back in class. But the behavior intervention plan is designed to address the most problematic behaviors that the kid has. It stipulates very specific actions and interventions that will be provided when the behavior happens. But more importantly, it directs teachers and the individuals implementing the plan as to how they will teach the kid, and that's the key difference. How are you going to teach this kid new behaviors that are going to take the place of the old ones that we know for a fact are somehow rewarding? What are you going to do in order to reward new behaviors that will replace the old ones that were problematic? And the only way to do that is to use reinforcement, use reward. Sometimes we have to use punishment, but reward is the key to teaching. Reinforcement, positive reinforcement, is the key to learning, really to learning anything. So within that plan, the behaviors are spelled out, and a specific plan is made regarding how we will use reinforcement-based techniques to teach kids new behaviors that will take the place of the old ones. All right, so let's move on. An additional part of the IEP is transition. Within special education, we provide services to some kids up to the age of 22, kids with severe disabilities, but most kids who receive services really only get it while they're actually enrolled in high school. So providing support to them as they head out into life, away from the services and the protections of special education, is essential. That process begins way before the kids are about to graduate. It can begin in middle school. It definitely has to begin at the beginning of high school. And there's a lot to that. But why is it so important? All of these factors contribute to the likelihood of a kid being successful once they leave formal secondary education. The big one is their success in some kind of a vocational setting where they can actually meet their own needs. And often transition planning is focused on acquiring some kind of meaningful employment. And meaningful employment that actually earns an income is going to be more important for some kids as opposed to meaningful employment that will give them a purpose and improved quality of life. It's going to be kids with more severe disabilities. So transition planning, it doesn't just involve, a big focus is on employment, but what are they going to do after high school? Perhaps they'll go on to college. Kids with learning disabilities need to be supported as they move to college, where they actually may be entitled to certain kinds of services and accommodations, again, not under special education law, but perhaps under 504 or under ADA. Considerations for living, considerations for having fun, and just general quality of life. In this process that begins at minimum in the 9th grade, this is when it's essential to the maximum degree possible that students are involved, because once they leave us, once they transition, they own it. So maximizing student involvement is essential in the transition plan, as is family involvement. We talked about universal design a little bit, and I will talk to you a little bit more about that when I can actually speak to you in person. A few notes on the risk. If we don't do this kind of careful planning, and we don't set kids up for success by supporting them, knowing where they're headed, the outcomes are rather poor, especially compared to kids who are non-disabled. So with these as examples, you don't have these kinds of basics. Think of how much of just life you wouldn't be able to participate in. Even with these 4 little bulleted examples, and there are many more. In consideration, kids are often disenfranchised in really profound ways from participating meaningfully in life. And good transition planning can minimize that and can really help to capitalize on the strengths that every kid to some degree brings. A big part of what we want to support is this idea of self-determination. I alluded to that when we discussed in class. I think I used some just kind of plain language, but I said that at some point kids really need to own their exceptionality. They need to own their disability. That doesn't mean that it is their fault, but that they have to take some kind of control, that they have to be as much as possible involved in the processes within school, outside of school, that involve them. Because in the end, they will be the one driving the train. So the earlier that we can teach them to advocate for themselves, to have input in processes that involve them, to develop opinions and be able to defend those opinions, and the more that they can be self-determined individuals. Halloran defines self-determination as really the ultimate goal of education. Education for any kid. Because really, especially in this country, I mean, there might be some countries that self-determination. I mean, if you're thinking of North Korea, self-determination isn't particularly important there. But in most countries, the idea of an individual having a unique identity and to have some kind of some degree of freedom and some degree of control over their life and over their destiny, that really is central to participating in society and in life. And for us here, that really is pretty central to why we go to school and the purpose of school. Yes, we learn knowledge and skills, but we do that with a specific, with a particular goal in mind, and that's of cutting them loose and letting them head out into the world and use what it is that we've given them in a way that works for them. And that's what self-determination is. But it has to be taught. It has to be facilitated. It doesn't just happen. And here's this last here, the Field 1996. This is a in a little bit more plain language. Making meaningful choices to control one's life based on knowing oneself in pursuit of needs, interests, and values. Again, kind of bringing it full circle. The sooner that we can involve kids in the planning of their own educational services, and then the planning of what they will do once they transition out of the shelter of formal schooling, the more that they will be able to make choices and take control and pursue whatever it is that they uniquely value and want to do. There are some slides here. This stuff is a little bit complex. I want to talk to you about this in person. If we want to talk about it a little bit more, all of this stuff is really important. And I may kind of come pick and choose and hit that back when we get back together. But if you have any questions about this, you can let me know. But empowerment, independence, self-understanding, self-realization, and then self-regulation, being able to control yourself, what you do, your choices. Really, those are the essential characteristics of what it means to be self-determined. And if you got a deficit in any of these, that tends to be a problem. And so what can we as teachers do? Each of these translates into an instructional strategy. We can model what it means to be psychologically empowered, to have an opinion, to support an opinion, to take a stance. We can support kids' desire for independence, desire for pursuing interests through providing choice when it's appropriate. Self-realization, attribution training, that's a little bit complex, but we can teach kids to be reflective. just like we ask you to be reflective as teachers. And then self-regulation. We can teach behavioral strategies. We can also teach thinking strategies that help kids become aware of what it is they do and how what they do influences what they get out of the world and how to make good choices. Awareness of behavior and then taking control and managing one's own behavior. All of that can be taught. All right, I'm not going to go into all of this here. All of those are good ideas. Again, within this this narrated PowerPoint, I think I'd rather allow you all to consider some of these proposed interventions and come to me with questions rather than just kind of choose one to dive into here. But all of these are great ideas. So consider these as you bring questions back to the class or to your discussion forums. Last note here about school culture, and really I think the film, including Samuel, one of the ideas I think that it brought up is, or that the filmmakers at least challenged us to think about, was the value of changing culture. Not only ensuring that kids have rights that are protected, but that we really need meaningful change is really affected by changing the cultures within which we operate. And one really important way that school culture, I think, can be nurtured is to encourage this idea of self-determination. That kids are not there just as little vessels to be filled, but they really are vessels to be filled, and they are shaped and shaped from within. That we teach human beings, and we need to not only give them knowledge and skills, but we need to help them understand, how do I become a fully developed and actualized human being? We can teach aspects of that self-determination, and it's important that you do so. Transition with kids with disabilities really should have self-determination at the center of our thinking as we engage in that process. The article that I gave you for the second class sums that up in just a couple of pages really nicely, and it's a good resource, so hang on to that. All right, that's it for this. We're going to move on to another topic. Early intervention is definitely covered in your text. The only big idea or big questions that I'll leave you with is, why is early intervention essential? That's one you want to answer for yourself. Why is it so essential? And then what are some of the basic ways that we go about doing that? That we go about identifying kids who might need assistance or services beyond the scope of what the majority of kids need. The developmental profile, the DP3 here, is just one of those. It's featured in your text, and you can see some of the notes here. But we'll talk about this in person. All right, so this segment's done. I'm going to post both of these. Remember, there's part 1 and part 2. Make sure that you listen to them both, and there will be another narrated lecture that is posted for class number 3. And with that one, I'll hit back on early intervention. We'll talk about communication, language, speech pathology, speech disorders, and begin to touch on some of the models of collaborative teaching that are also covered in the text. All right, see you then.